Thank you very much. Thank you very much for this kind invitation. My name is Anastasia Dashiou and I'm working at the University Hospital of Larissa in Greece. And the topic I've been asked to talk about is the pathogenesis of brain AVMs. I have nothing to disclose. We all know by definition that brain AVMs are networks of abnormally connected arteries and veins that are characterized by the absence of intervening capillary bed. They are really rare pathological entities. However, they are very important as they constitute the most common cause of hemorrhage for children and young adults. Actually, it has been estimated that the lifelong morbidity and mortality are almost 35 and 30% respectively. So regarding pathogenesis of brain arteriovenous malformations, the main question is whether they are congenital or acquired lesions. And for many years, we used to believe that brain AVMs are congenital lesions because they are associated with hereditary diseases, but also they are associated with non-hereditary disorders. And in these cases, we call them as familial. For our better understanding, when we are talking about congenital lesions, congenital are the lesions that are presenting at birth but may be detectable later in life. And familial brain AVMs are the AVMs that may be affected at least 2 or more up to third-degree relatives in the same family. Back in 2007, Van Wegum and his co-worker tried to find out these familial cases, and actually they did an excellent work and identified in total 25 families, including 53 patients harboring brain AVMs in the same family. More recently, studies have shown that there are single nucleotide polymorphisms, the SNPs, which are associated with brain AVM formation, which actually are characterized with an increased risk of hemorrhage. These SNPs are a small part in the DNA and may vary among individuals. They are located in the NOTCH4 gene, and this gene, which is a protein coding gene, actually is associated with schizo disorders and malformations, including brain AVMs. And also there are several studies in the literature showing overexpression of different angiogenetic and vasculogenetic factors such as VEGF, MMP9, interleukin-6, and TGF-beta, which are present in patients suffering brain AVMs. So we all know that genetic factors may play a role in the development of brain AVMs. However, there is an increasing number of de novo cases in the pertinent literature, and this theory is supported by the statements that only 1% of these lesions are identified during the first 2 years of life. There are many cases diagnosed in adults without being present at birth. We are all familiar with the phenomenon of brain AVM recurrence, which happens especially in the pediatric population. After a complete excision of the lesion, we may see that a new de novo case is coming up, confirmed by DSA. But actually, in this case, we are not sure if these cases are really de novo cases, or maybe it's a phenomenon due to the immature cerebral vasculature in children. And on the other hand, Carlson and his workers developed a mathematical model proving that brain AVMs are developmental rather than congenital lesions, which may present up to the 25th year of age as that time our brain matures. In 2020, a year ago, we published in the Pathogenesis literature an article dedicated to the pathogenesis of brain AVMs. And in that article, we did a systematic review of the literature searching for de novo cases reported. And actually, we found 43 relevant articles in total, including 48 cases. 1 year later, in 2021, Florian et al. Did a similar work, and their systematic review of de novo cases actually revealed 53 articles in total, including 58 cases of de novo brain AVM formation. So we can easily realize that in a short period of only 1 year, there are 10 more de novo cases reported in the literature. No matter if brain AVMs are congenital or not, the fact is that brain AVMs are dynamic rather than static lesions. So according to Komiyama in 2016, he reported that brain AVMs are not only able to rupture, but they can also grow, remodel, and regress dynamic lesions. And several years earlier, LeBlanc et al. Also stated that there are factors that seems to play a major role in vasculogenesis, angiogenesis, and vascular remodeling. And these factors are associated with the development of vascular malformations, including brain AVMs. So I would like to, at this point, I would like to show you a couple of de novo cases. This is a 53-year-old woman suffering frontal lobe hemorrhage due to a rupture of a frontal lobe brain AVM. And the patient underwent SRS twice in 1998 and 2001, and 2 years later, the follow-up DSA revealed a de novo brain AVM case. This is another case of a 12-year-old girl undergoing a brain MRI in 1998 with unremarkable findings. 10 years later, the repeated brain MRI showed the de novo brain AVM case confirmed by a DHA. And also another example of a 9-year-old girl. She underwent a brain MRI for the diagnostic workup of seizures. And at that time, the findings were absent, but a couple of years later, repeated brain MRI revealed an AVM case confirmed again by DSA, which was actually a de novo case. So as we all understand, genetic factors play a major role in the development of brain AVMs. However, genetic abnormalities alone are not enough. In most of the cases, a second hit is required for the initiation of angiogenetic and inflammatory processes that are responsible for the formation of brain AVMs. And the second hit may be either hypoxia, trauma, radiation, epilepsy, inflammation, neuro disorder, hydrocephalus, or hormonal disturbances. So back in 1997, Lajoignas reported that there should be a biological dysfunction. This is a congenital event that is occult at birth, but with the cooperation of additional triggers, the so-called revealing triggers, this dysfunction becomes morphologically detectable later in life. And in this process, which is a vascular actually remodeling process, we may have the formation of brain AVMs. And according to Lajoignas, the target is most probably to be located on the venous side of the capillaries. Many years later, Kim and colleagues mentioned the response to injury model for the formation of brain AVMs. According to this model, under normal circumstances, an injury is responsible for the overexpression of angiogenetic factors such as VEGF. This overexpression is enough for the initiation of different cascades of angiogenesis and vasculogenesis, and in most of the times these processes are leading to a normal response. But in some cases we may have a dysplastic response, and in that case we may have the development of vascular malformation, including brain AVMs. But why is it so important to realize the pathogenesis of brain AVMs? The concept is that it is really necessary for understanding the biological behavior, the natural history, and the overall functional outcome, which differs among patients in these cases, and also for socioeconomic issues and for reimbursement purposes too. In 2019, there was a consensus meeting which was held in Athens, Greece. This was dedicated on the natural history of brain AVMs. And at this meeting, worldwide experts expressed their opinion regarding the management of brain AVMs. And all the experts actually emphasize that there's no doubt that brain AVMs are rare, heterogeneous, and complex lesions, that they require a multidisciplinary approach. But the main goal in this case is to treat and not to harm. And with this, I would like to sum up. And the take-home message is that finally, brain AVMs are dynamic rather than static lesions. An underlying genetic predisposition may play a role, but genetic factors alone are not enough. In many cases, in most cases, second hit is required for this genetic susceptibility to be detectable later in life, and as a result for the formation of the brain AVM. However, the exact pathophysiologic mechanisms of the formation of brain AVM still remains obscure. And before I finish my lecture, I would like to remind you that the first person who said that the best treatment is not to harm was Hippocrates, with a very well-known proverb of Elaine Imi-Vlaptin. So thank you very much for your attention.